Hospitals across the country are increasingly struggling to keep up with the surge in COVID cases, some pushed to the brink once again.
Yeah, and hospitalizations have been climbing in Massachusetts as well. Cases also up again today. Let's bring in Dr. Ali Raja. He is Executive Vice Chair of Emergency Medicine at Mass General. Dr. Raja, thanks for your time today.
Thanks, Ben.
All right, so cases today up 23% from last Friday in Massachusetts. We had about 1,400 or so reported today. So what are you seeing as that's translating into hospitalizations at a hospital like yours?
Well, fortunately, Ben, it hasn't quite translated into hospitalizations yet. We're seeing those numbers rise week after week. But I've got to tell you, the great thing is that here in Massachusetts, we've got almost 75% of the state who's eligible at least has their first shot of the vaccine. And that's really helping us. I have colleagues in Texas and Florida, and they're underwater in their hospitals. Unfortunately, our hospitalizations haven't risen the same amount yet.
Yeah, because a lot of the breakthrough is mild and moderate, right? Not as severe. So that's good, at least here in Massachusetts. I mean, so as someone who's been dealing with this pandemic every day, what does concern you about the current trends, what you're seeing across the country?
Well, Erica, it's a good question. I'm definitely concerned about what's going on across the country, but I've also got to tell you, right now, we're seeing just a really busy time for our hospitals. The summer's been exceptionally busy. All of our hospitals have been full, typically not with COVID, with real emergency and inpatient hospital stuff. Our staffs are really tired, busy, quite honestly, a little bit burnt out. And I'm worried that if we see another surge, what the impact of that is going to have on the burnout of the staff that's already been working so hard all summer.
And Dr. Raja, we've talked a fair amount about breakthrough cases in recent days and weeks. Even here in a state like ours, we have so many people vaccinated. Those breakthrough infections are running about 35 to 40% of the new cases that we see. Are you seeing those kinds of cases at MGH? Does it lead to hospitalizations? And do we still feel like the vaccines are doing what they need to do to try to get us out of this pandemic?
Let me answer all three of those questions, Ben. So first of all, yes, we are seeing those cases at MGH, but fortunately, it doesn't lead to most hospitalizations. I saw 2 patients yesterday during my shift who needed to come into the hospital. Unfortunately, neither one had been vaccinated. And so the vaccines are doing what they're needing to do. But unfortunately, with a quarter of the population who can be vaccinated, not vaccinated, we're still admitting patients with COVID. Fortunately, it's not as bad as other states right now.
All right, Dr. Raja from MGH, we really appreciate your time. Thanks so much.
Thank you.